Greetings, it's Dr. Fisher with Road to Wellness, bringing you some more information on your journey to be well. Let's talk about today diabetes mellitus or type 2 diabetes. They're usually used interchangeably, but let's talk about what that is. And diabetes is when there is an increased influx of sugar running around in your blood vessels. Okay. So your pancreas has a responsibility to excrete insulin into the bloodstream to allow the cells to open up and uptake the glucose. But when that doesn't happen and the glucose is just running around in the bloodstream, we have a problem. That's when you end up being diagnosed with diabetes mellitus. And the way you know if that truly is what it is I would encourage you, if you don't know what your diabetes status is, and you're experiencing symptoms such as you're thirsty all the time, you're having to go to the bathroom all the time, and you're hungry all the time. So increased thirst, increased urination, increased hunger are the three classic signs to go get tested for your hemoglobin A1C. Again, that's have your hemoglobin A1C tested. If you don't know your status of diabetes, but you're experiencing running to the bathroom all the time, hungry all the time, and always thirsty. Okay. And some of the ways those can be caused is usually if you live a sedentary life, which means what? You don't exercise. Okay. You're eating processed food. What does processed food mean, Dr. Fisher? You go to restaurants to get something quick to eat. You're trying to feed the kids. You're trying to feed yourself. Life is stressful. Jobs are stressful. And you're just not being conscious of what it is that you're eating. Also, I know genetics. Many people will say, my mother had it, my father had it. So quite frankly, I will have. No, you have the gene to potentially have it, but it doesn't mean that it has to manifest in your body. You have the ability to change the status of your family tree. We call that epigenetics. Epigenetics just simply means that just because my father passed away with diabetes does not mean I'm going to have it. That means I have to look at my father's lifestyle or my mother's lifestyle, and I have to do something different. So if my mother ate potato chips and my mother ate fried food all the time and my mother ate a lot of cupcakes and sugary foods and she ate a lot of processed foods, then I'm going to look at doing something different. That means I'm going to eat more fruits. I'm going to eat more vegetables. I'm going to eat more wholesome foods, more whole foods, more nuts, more seeds, drink more water. And I promise you, if you do that, you will never manifest diabetes. Okay. One of the other things that's very important, because we need to understand what some of the complications are with diabetes. If you're not sleeping well at night, if you're experiencing neuropathy, which means you have some numbness and tingling that's going on in your feet and in your fingers and your hands, if your vision is changing, which means some things are starting to look a little bit more blurry to you, you really, really want to have that hemoglobin A1C again checked. There are things and ways that you could really get it down. If you go to the doctor and they say, oh, you're pre-diabetic, you either is or you're not. If you're pre-diabetic, that just means that they're saying in probably the next year or two, you will be a full-blown diabetic if you continue eating the way you eat. You go to a grocery store, where did you shop? If you're not shopping the perimeters of the stores, then I want you to reconsider how you're shopping. Because many times if you become diabetic, you're purchasing foods that are in the aisles of the store. And that's where all the preservatives and the fillers are that will put you at increased risk for diabetes. So I want you to be very mindful of how you're going to the store and how you're shopping. With guys, if you're having issues with an erection, being firm or being able to maintain stamina with your loved one, then I'm going to suggest you consider having a hemoglobin A1C done, because that's one of the biggest side effects. Now, one of the number one factors that can be caused by your blood sugar being elevated is dialysis. I don't know if you guys have noticed, but I want you to wake up and be a little bit more conscious of what's happening in your environment. There is a dialysis clinic on every corner. It's like a grocery store. You've heard of DaVita, you've heard of Fresenius. So if you're not conscious of it, I want you to just really open your eyes. That's because diabetes is the number one indicator that can cause people to end up on dialysis. That means that you spend 3 days a week, okay, for 3 to 4 hours sitting in a chair, having your blood removed, removed, returned, because they're filtering out all the toxins that you're eating. It causes a lot of heart complication. It causes a lot of blood complications. It causes a lot of liver complications and kidney complications. So I highly encourage you to stay on top of this, because it's no way to live your quality of life going forward. So you want to be very, very mindful of what your blood sugar levels are. So normally when you go to the doctor and they diagnose you with diabetes or tell you your hemoglobin is above 6, because generally anything under 5.7 is pretty normal. But once you start getting over 5.7, then they want to start putting you on medications, right? I want you to be conscious of this. Do some lifestyle modifications in order to improve your status. Start walking and exercising to improve the function of your pancreas. Start watching what you're eating, okay? Start drinking more water, okay? Start eating more fruits and vegetables. And I promise you, those are some of the things that will help you. There are some natural supplements that we have to improve your blood sugar levels. One is called Diabetes Pancreas. That's a supplement that is full of herbs to help your pancreas and your body to begin to detox and to also filter out some of those areas that are toxic that's causing your pancreas to not work the way it needs to. Also with diabetes, digestion is an issue. So I always encourage you taking some digestive enzymes before you eat. A little bit of HCl after you eat will help improve your blood sugar levels. So it's very important that you don't get diagnosed with diabetes, because 1, you might end up on dialysis. 2, you could very well end up with amputation. And that you don't want, because I call it a traveling amputation. When you end up with diabetes, remember your circulation is going to be poor. You're going to have some neuropathy, and you will start to experience some numbness and tingling in your feet. And so when circulation becomes a challenge, and you end up with not being able to, move things and do things the way you want to, then they end up having to amputate your toes. Then they start with your foot. Then they travel on up to your legs. Now you're dependent on people to help you. So stay in front of your health. Get educated, learn about what you need to do to be healthy going forward and to also help your entire family. Don't go and allow them to just throw you on medications and say, you're diabetic, here you are, take this the rest of your life. You don't have to do that. I'm here to help you. This is Dr. Fisher, Road to Wellness, and I want to make a difference in your life naturally.